When we talk about inclusive learning, we consider all kinds of factors, both visible and invisible, that our students bring into our classrooms. Books, articles, videos, and workshops tell us how we can make our spaces more welcoming in order to facilitate learning. Interestingly, although 10% of the human population is left-handed, we don't often think about this group's needs when we think about inclusivity. Yes, we find tablet chairs for the left-handed in our classrooms, and sometimes think about where they're seated during a meal, but too often their specific needs are not considered. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UT Health Science Center's Teaching and Learning Center. Each month, we interview members of our faculty about their research and its impact on the higher education community. Today, we talk with Danita Adams, Assistant Professor in the College of Dentistry. She, Amy Hall, also from the Teaching and Learning Center, and Kelly Jo Fulkerson Dakua, now with Rhodes College, have published Inclusion in the Clinic, a mixed method study of left-handed students' perceptions of using cordless keyboards in the Journal of Dental Education. Danita, welcome.
Thank you. Thank you for having me.
I'm really excited about your article and digging deep into what you wrote about it. Can you talk first about the inspiration for your article and wanting to write about the challenges of left-handed students in a clinical setting?
Absolutely. I believe my first inspiration was my son, which is left-handed. And as a toddler going into school, the teacher called me in and said, your son has some dexterity issues and he's a little behind. And so as a new mom, I panicked and I was like, what in the world? And so I come to find out it was not that he had dexterity issues. He was left-handed, was not identified as left-handed, and was given right-handed scissors and things like that. So I kind of have been on the lookout for left-handed situations because, you realize left-handed students learn to overadapt very quickly, but there are things that we can do to help them. And so left-handed notebooks, having them not sit at a right-handed desk, sit at a table. So things like that kind of came into play as a new mom.
My youngest son is left-handed. And of all our kids, it was the first one. And I agree with you. It really puts a new perspective on things. So we're doing college tours. We go in and it says, where's the left-handed desks and left-handed notebooks? And where's the scissors that I can use with my left hand and all kinds of different things. So I really appreciate that.
Yeah, you don't realize really the challenges that they face. Again, they're very adaptable and they learned how to work like that. But if we can make life easier for them, I found a left-handed store. And so we kind of followed some things that have in there.
So can you talk more about left-handed students then and the challenges they face in a clinical setting?
For us in our clinic, everything is supposed to be ambidextrous, like the chair, the light swings both ways. The problem is our computer is stationary on the right side. There's more room on the right side, so a left-handed student the operator has to move everything around to the left side. Sometimes the hoses come off. They can't see the computer. They would have to write all their information down on a piece of paper, transfer it. So the very first years I was here, I was watching them struggle a little bit. You see the frustration, and then time management became an issue, especially for the left-handed students. And so with time management becoming an issue, we had to move that into our competencies. And as soon as the competencies came about with time management, that's when the left-handed students, you would see them with their frustration, you can't really understand the data that they're collecting, but it's a lot. And they can't see the computer, they can't reach the computer, so they're writing it all down. So that was really our main goal of trying to get the left-handed keyboard, the cordless keyboard, so they could enter their data from their side of the chair.
Is that kind of setup pretty typical of dental labs, not just at UT Health Science Center, but at other places as well?
I think that's pretty much, most places don't really think about the left-handed students. I know at UT at some point they used to have a left-handed station, but because we have so many more students and they don't have a particular assigned cubicle, they have to share cubicles. So I feel like that's pretty common.
So you talked a little bit about how the station setup affected students and how it affected their time. Can you talk a little bit more about how it affects their learning?
I don't feel like left-handed students have a problem learning. They're very bright. Left-handed students are very bright. I think more of the challenge comes from the actual doing. I know some of our students have quoted, faculty have told me when I'm learning instrumentation just to watch what I do and do it backwards. If someone said that to me, I'm not sure I would really
That's
follow.
terrible.
And that's what we found out in the research. Some of the students, just watch what I do, and then they would find out that it was very frustrating for them. But for learning itself, no, I don't think left-handed students have a difference in learning.
So your paper talks about the introduction of cordless keyboards then into the clinic. So what was the thinking about why you would do that?
The reason we would do that was to make sure that when they had their competencies, they had the same thing as a right-handed student. They had the same time frame. They didn't worry about entering their data. Like I said, there's so much data collection that goes in with a lot of things they do in our department. And when they had to enter their data from the wrong side of the chair, they got stressed. Their accuracy was wrong. It was an infection control violation. There's all these things that came into play being on the left side of the chair. So the cordless keyboards, we found out after implementing them, the students, number one, were just grateful that they could sit on their side of the chair, enter their data only one time. And faculty would mandate that they had all their data in the computer when they came over. So these students had a real lag in their time and accuracy and things like that. So the cordless keyboard was a huge benefit for the left-handed students. And the students that have come since then, it's been at least 3 or 4 years, love the fact that we recognize that there was a challenge.
So the advantage is being able to move that keyboard anywhere on that station.
Yes, they can move it with them. They sit on a different side of the patient chair with a cart. And so they're able to sit on their side of the chair and enter their data. And so the patient, when they were there, had to sit in the chair longer as well because they had to put it on paper. Then they would have to swing around, go to the right side of the chair where the computer monitor is stationed and enter the data there. So the patient was inconvenienced, the student was inconvenienced, and it just saved time and accuracy for entering their data.
As you and I are talking, I'm sitting here at a keyboard, a cordless keyboard, and it is nice to be able to move it around, but it also has a keypad on the right-hand side.
Yes.
Did you do any research on the kind of keyboards that you use and how to accommodate left-handed students with the keypad, or do students not normally use the numeric
The students
keypad?
normally not use the keypad. I would believe that if we would incorporate those, they would like that as well. But we needed to keep it small and maintainable, movable. That really, the one that you have is quite large for the cart that they have to put instruments and other things like that on there.
See.
So we did need size, did need adaptability, and I think that one was too big. So yeah, we did do our research.
So beyond the keyboards, what other accommodations might be helpful for left-handed students in a clinical setting?
What we found in our research and asking new students, and this happened last week, one of the students is having to write his information down because he wears contacts and he cannot see. The monitor is still stationed on the right side of the chair. One of two things: either we need to have a monitor that could be put onto something that's movable, like the light that swings back and forth, or we need to get left-handed students iPads where they'll be able to see it and use it in their station. So those are two things that we're looking at right now, which would be better, being able to move the monitor or get iPads for only left-handed students. So that's where we are.
Are the tools the students use pretty designed for both left and right-handed students? I'm not familiar with that world. So I know, like, for example, scissors with my son.
Right.
There's right-handed scissors and left-handed scissors.
That is correct. There are some things like things they take extractions out with, and I am pretty sure in oral surgery they do have left-handed ones for the left-handed students. Part of our research was in even medicine and surgery. These students found that as well, that they didn't have a left-handed faculty, and they would say, well, just watch what I'm doing. So we found that our students and their students do have similar problems because I just can't imagine somebody telling me, just watch what I do and do it backwards. I just couldn't do it. But it's what we have in our department. All of our instruments are ambidextrous, which is a wonderful thing. But for extractions and things like that, there are specific instruments for left-handed, right-handed.
So you talked a little bit about the benefit of students being able to do things in a more timely way when they have the more proper equipment. Are there other benefits to the students to provide these more inclusive learning environments that are meeting their needs?
Um, I would say in our clinical setting, I believe this is really our biggest problem. It would be beneficial to ask the students again, since we have gone this far, what are other things that we could do to help them? I know what we did find is that our students wrote a wealth of information for us, and we're just grateful that we acknowledged that they had a challenge. Some of the students, I can read a few of the things that we found. One student wrote, I did not realize coming to dental school that I would have to take extra steps to adjust a cubicle, accommodate an instructor, and feel obligated to apologize at every appointment.
Mm.
So when they write things like that, I mean, we didn't know they felt like that. Some of these things that they wrote, and then when we did our post survey, the things that came back were the cordless keyboard reduced my stress, expedited appointments and charting. It's stressful to switch everything back and forth, but a small thing like a cordless keyboard made it much easier and less stressful. I feel like we've made a big impact just with the start of what we do, but I do feel like in the classroom setting, I don't think there's much accommodation other than if you know that you have left-handed students, put them at the end of a row so they're not bumping into a right-handed student. In our laboratory, we have separated left-handed students, and they all have like a left-handed person that works specifically with them. And that person has come from dental hygiene. We
Mm.
do not have a left-handed faculty. So after our research, we did make left-handed videos for our left-handed students to be able to go back so they could mirror what the left-handed person is doing. A left-handed student sits on a totally different side of the chair at a totally different position than a right-handed student. So being able to pull them aside and have them grouped makes them feel better. And we always get feedback, wow, we're so grateful that you guys have done this for us. So I feel like in our department especially, that we are identifying and we are meeting a need for some of our left-handed students. In our research, we found that left-handed students, there's more in the population, and now 10% of our population is left-handed, whereas before it was like 2 to 3%. So when you have 130 students in a class, you're looking at 10 to 15 students that are left-handed, which doesn't sound like a lot, but it becomes like you have a D3 class, you have a D4 class. So now we have over 20 to 25 students that are left-handed.
What's really striking me as you're talking is that we talk about inclusive learning environments,
Mhm.
and we have students that come in with all kinds of differences from us, and the only way to really find out what their needs are to ask them, because we
Right.
don't have that kind of background, and even something as visible as being left-handed and how different the needs are for these groups of students than the rest of our students.
Right. I was really surprised the information that they provided for us that we didn't really know. I mean, like I said, they're very adaptable. They've learned how to adapt. But if you ask them what you can do to help them, they were very helpful in providing us that information in a
And probably
sense.
very happy to do so as well.
Absolutely. I
Yeah.
mean, because they knew, I mean, we were there to help them. And there are things that we would like to carry forward to make it even better. Like for the student that has vision issues, they still cannot see the monitor. That
Mm.
bothers me.
So, what would you say are some of the key findings of your research?
The key findings that the students were very grateful that we did the study, that we saw the need, we were meeting a need that they had. The things that we found out in our research really was just being present and listening and knowing that they were heard. That they were seen in a positive light. That they weren't being seen as like a troublemaker. The students were very frustrated that faculty would come over and expect them to move everything for like a 10-minute check, and then they have to move it all back. So they found it very frustrating. So talking to our faculty, they now just will have them move a certain part of it, not all of it. So the students are not as stressed. So I mean, not asking the question, we wouldn't have found out that answer. And like I said, we still don't have left-handed faculty, so we're still having to work through some of these issues. But the students are very kind in the way they explain it to us, and they appreciate that we're trying to accommodate what we can.
So thinking more broadly beyond dentistry, I mean, as a place like UT Health Science Center, we have dentists and nurses and doctors and health professions with physical therapy and occupational therapy and pharmacists. All of them use tools and are in the clinic and somehow. So if you were to think about this more broadly, what implications do you think about with your study that could be useful for other health sciences?
I think the biggest thing that we pulled out of ours is being able to create videos for our students. They're housed in YouTube. They're readily available for them. I think that for now, that was our biggest plus, is that we created videos for those students to be able to go back and watch. So in other departments, if they don't have faculty like we do not, find a faculty somewhere or a partner that will come in and do videos for their left-handed students. I think that would be even a wonderful option for surgery, for different procedures, like nursing. I mean, how they would accommodate for those students, and just be mindful with the left-handed students. There's so many different things, avenues, ways we can help them. But when you have a left-handed person, you see them kind of crunched up in a desk, see if you can't move them to an aisle, things like that. But I think our biggest bonus for us was having the videos made. And the students really do appreciate being able to see how a person would sit using that particular instrument. So we went instrument by instrument by instrument, walking them through each step. And that way they can go back before they come to the clinic and feel more confident on their side of the chair. Just making sure, like in surgery, that they provide left-handed instruments for left-handed. They need to know how many left-handed students they have and provide those instruments for those students. And then just provide the videos. And right now, that's where we are with our research.
It also strikes me that raising the level of awareness of the needs of left-handed students also potentially raises an awareness of the needs of left-handed patients, so that when we're asking them to do something, like my right hand is in a cast or something like that, or, being able to think about the fact that, yes, you have needs because you're left-handed when I ask you to do something and you're talking to me or doing something in my clinic.
Well, that is one of the questions that we try to raise awareness to for the students when they're teaching oral hygiene instruction and brushing. You always want to ask the patient, are you left-handed or right-handed? Because you don't want to just assume they're right-handed and you just hand them a toothbrush and they try to adapt and do what you want them to do.
Mm-hmm.
You want to ask them the questions, are you left-handed or are you right-handed? Just for that very fact, you don't want to teach them the wrong way.
Yeah. So what are the next steps? What are some unanswered questions that you have that is going to lead to your next paper?
Really working, like I said, my goal now is to try to have our monitor moved or have iPads. And so that's probably our next concern, is trying to make sure that the students have what they need to provide the best care possible with time management, with accuracy of data, and just knowing that they and feel most confident in what they're doing. So I don't know where outside of this research we could go. I know in our clinical setting, that's my next steps.
Great. So Danita, I really appreciate this. We always talk about inclusive learning and how do we make an inclusive environment for our students that really encourages us to learn, and thinking about left-handed students is a whole new aspect of this. And I really appreciate your thoughts and your insight. And we look forward to future research.
Well, thank you so much. I appreciate you having me.
Great. Thank you. And that's this month's episode of Teach Well, Learn Well. Thank you, Danita Adams, for your insight on inclusive learning, particularly for left-handed students working in our clinics. I'm Tom Lochner of the Teach Well Learning Center at the University of Tennessee Health Science Center. Until next time.